If you're caring for someone you love with ALS, you already know it's a journey of constant learning. Well, today, we're going to tackle a huge part of that journey: durable medical equipment, or DME. We're going to break down what it is, how you get it, and most importantly, how to master it. The goal is to turn something that feels totally overwhelming into a toolkit that actually empowers you. So let's open it up together. You know, this quote from another caregiver just hits it perfectly, doesn't it? The whole world of DME can feel like this impossible puzzle, all this complex equipment and confusing jargon. But just like cracking a code, once you figure it out, it unlocks this incredible new level of capability and confidence. And that's exactly what we're going to do today. We're going to hand you the key. So what is DME exactly? Well, to put it simply, it's any medical gear that's built to last, prescribed by a doctor for a very specific need, and, this is key, it's meant to be used in your home. So we're talking about things like wheelchairs and hospital beds, not stuff like bandages. For ALS care, this equipment isn't just helpful, it is absolutely fundamental to managing daily life. All right, let's start by looking at the actual tools you'll be working with. We're going to break them down by what they do, from equipment that helps you get around all the way to devices that support breathing. We're going to build a picture of what a complete care toolkit really looks like. For a lot of people, mobility is one of the very first things that changes. This is especially true since about 2/3 of people with ALS have what's called limb onset symptoms first. So, as you can imagine, equipment that helps with movement is a critical first piece of the puzzle as the disease progresses. You can really see the journey laid out right here. Care often starts simply, right? Maybe a cane or a walker for a bit of extra support. But as needs change, you progress to a manual wheelchair, and then eventually to a power wheelchair. The equipment is designed to evolve with the person. The real pro tip here is to try and get ahead of the curve, to anticipate the next step before it becomes an emergency. Okay, moving on to something that is honestly one of the most physically demanding parts of being a caregiver: transfers. Helping someone move from a bed to a chair or into the bathroom. This equipment is designed specifically to make that whole process safer for everyone involved. And this number, wow, it really tells a story. Almost 1/3 of caregivers report some kind of physical strain or even injury just from doing transfers. This stuff isn't about convenience. It's about protecting your own health so that you can continue to provide care safely. And here it is. This is the payoff. A caregiver talking about mastering a piece of equipment called a Hoyer lift. They said it saved my back and sanity. That says it all, right? These tools aren't just machines, they are sanity savers. They can take a really high-risk, stressful task and turn it into a manageable part of your day. Now for something that is an absolute lifeline. For the 1/3 of people whose ALS starts with what's called bulbar onset, meaning it affects speech first, communication devices are everything. They make sure a person's voice, their thoughts, their personality, all of it can still be heard loud and clear. You've got this whole spectrum of communication tech. It can start super simple, like a board with letters and pictures. But the real game changers are the speech-generating devices, or SGDs, and eventually, these incredible eye-tracking systems. Now, the number one tip you'll hear from experts is this: introduce these devices early. Give your loved one time to get comfortable with the technology before it's an urgent need. Okay, so we know what all the tools are, but how in the world do you actually get them into your house? This next part breaks down that path, from realizing you have a need to the delivery truck showing up. And let's just be real, this process can be one of the biggest headaches. The whole thing kicks off with a professional assessment, usually from an occupational or physical therapist. They're the ones who officially determine the medical need. That lets a doctor write the prescription. Then you enter the maze of insurance companies and equipment suppliers. And notice that last step. Yep, being ready to fight for what you need is a huge part of the process. Now, when we talk about cost, this is a pretty common picture for anyone on Medicare. The plan will typically cover about 80% of the approved cost. Now, that is a massive help, but it also means you have to be ready to figure out how to cover that other 20%, whether it's out of pocket or through other resources. And this slide right here is the source of so much frustration. See, most insurance systems are built around this idea of functional improvement, of getting better. But with a progressive disease like ALS, the whole point of the equipment is to safely manage a decline and maintain quality of life. It's a total mismatch, and it's why so many claims get denied at first. So you've jumped through all the hoops. The equipment has arrived, now what? Well, the next phase is all about making it part of your life.
And it's not just about using it, it's about mastering it, so it becomes a smooth, effective part of your daily routine.
This timeline just paints such a clear picture of how all these different pieces of equipment work together during a single day. You've got the lift in the morning, the communication device at midday, a shower seat for bathing, and then a ventilator for breathing support at night. They're not just separate tools, they're an integrated system that makes the day work. And here is another golden piece of advice from a fellow caregiver. The time to figure out how to use a patient lift is not when you're stressed or in a hurry. You have to practice when things are calm. Build that muscle memory. Build that confidence. It is absolutely essential for using it safely when it really matters.
This equipment is working hard for you, so a simple maintenance routine is your best friend. Just think of it in 4 easy parts. Clean it regularly for hygiene, give it a quick safety check every week for things like worn slings or loose bolts, charge the batteries every night, and keep your supplier's number on the fridge so help is just one call away.
We've talked about the challenges, the insurance headaches, the steep learning curve. We know it's a lot. So in this last section, let's focus on actual strategies to face those challenges head-on so you can navigate the road ahead with real confidence.
The big takeaway here is that you're not powerless. For every hurdle, there is a strategy. If insurance says no, you appeal with clear documentation showing the progression. You plan ahead. Don't wait for a crisis. You insist that the supplier give you a proper hands-on training session. And never, ever underestimate the power of connecting with other caregivers online for amazing real-world advice.
And amidst all this technical talk, please don't forget this. This is so important. This equipment becomes a huge part of a person's life, a part of their identity. So whenever you can, involve them in the choices. I mean, something as small as picking the color of a wheelchair might seem trivial, but it can be a massively powerful way to hold on to a sense of self and dignity. So when you boil it all down, this is what it's all about. Learning to use this equipment isn't just about learning to operate a machine. It's the key to reducing your own physical and emotional strain as a caregiver. It is the key to providing safer, better care. And at the end of the day, it's the key to making life better for both you and the person you love. So I'll leave you with this question to think about. Now that we've sort of demystified the what and the how for caregivers themselves, it kind of pushes us to think bigger, right? How can we, as friends, as a community, as a society, build better systems to support these families? It's a big question and one worth thinking about. Thank you so much for joining me.